Joining us now from Washington, Democratic Senator from Connecticut, Chris Murphy.
Also, like Lenny Kravitz, wearing leather pants.
Is that right?
Yes, this morning.
So
you won't be able to see it on the shot.
And Republican Senator from Louisiana, Bill Cassidy. They're the co-authors of a new bipartisan push for mental health reform. Gentlemen, thank you so much for joining us. You couldn't be more different on the issue of guns. You've said as much. There's not a lot you agree on, but you have found some common ground here. What is it?
Well, listen, we both unfortunately come from states where we've had just enormous, horrific tragedies with respect to gun violence. And, I don't think it's any secret that we're going to likely have trouble finding common ground in Congress on gun laws over the course of the next couple of years. But we absolutely can find common ground on fixing a very broken mental health system. So Bill and I have been working for the last 6 months, a conservative Republican, a progressive Democrat, to try to put together the first comprehensive reform of the nation's mental health laws. It's been introduced in the Senate, at least during the time that we've been there. We're focused on building capacity for inpatient care, for outpatient care, trying to bring together the physical health and the mental health system and continuing to reduce discrimination. And hopefully we'll be able to break through some of the inaction around these issues that affect families and individuals suffering mental illness.
Chris, why has mental health been ignored for so long?
Yeah, it's hard to understand why Congress has taken a pass on this for so long. I mean, part of it is that we do need some more resources, and it's hard to come up with those resources. But this is an issue that really should unite both of our parties. Every single member of the Senate has a family member or a close friend who's been touched by mental illness, and we're spending and wasting a lot of money by warehousing people in prisons, by leaving people lingering in hospitals. We can save a lot of money if we fix this system.
Senator Cassidy, what does this bill do, if anything, about access to mental health care? I understand the greater goal of providing mental health care, but access to mental health care for people.
Yeah, so it attempts to expand access. It asks states to report their outcomes. Now, if a state's doing a really good job, the hope is that other states will imitate what the one is doing, which looks so good. There's also grants in which we expand the number of mental health providers. Right now, there's an incredible shortage of mental health providers. So there will be an attempt to increase that number. That's a good start. We have more to do, but we also are going to increase the number of Chris mentioned capacity for inpatient beds. There's right now an incredible shortage of inpatient beds. So that's another thing we're doing to expand access.
Chris, you and I are both residents of Connecticut, and obviously both touched in different ways by the horrors of Newtown. I remember after Newtown, we all talked about the things that we needed to discuss: gun laws, mental health, other issues. But it devolved into an ugly gun debate immediately, and mental health got brushed aside. Do you think Congress is ready? Do you think America is ready to have this discussion now?
So, I mean, I wish that we weren't having this debate over fixing our mental health system because of these gun tragedies, because frankly, Bill and I have been working on fixing our mental health system for a long time, and it should be fixed because it's broken, period, stop. But we do have this political moment where people are paying attention, and we'd be fools not to take advantage of it. The fact is that the people who are mentally ill are much more likely to be the victims of gun violence than they are the perpetrators of it. But there's no doubt that by increasing capacity, you're going to make it less likely that somebody's going to walk into a school or a movie theater who's very sick and cause this kind of damage.
And Senator, the Republicans in our party that you work with, do they understand the need to expand mental health?
Absolutely. If you speak to a sheriff will say that he is the largest provider of mental health in his county or in his parish. In Louisiana, we have parishes. And he'll also say that oftentimes the person they have most trouble with within that system is he or she who is mentally ill. So this is neither a right nor a left issue. It is an American issue. And we think we can find rationale for it both from the patient's perspective, the family's perspective, but also the societal perspective. We'd rather have somebody whose first episode at 15 is recognized, who is then redirected to a path of wholeness and wellness, who does not enter the criminal justice system, who gets a good job and pays taxes, as opposed to become eventually something less than they could be. This is going to be an issue good for all of Americans.
All right, guys, thank you so much. Greatly appreciate you focusing on this serious topic. We appreciate it. Thank you so much, Chris Murphy and Bill Cassidy.